I'm Celia Harrison, Chief of Staff at Solas. And at Solas, we're developing an advanced wound care product seeking to clean chronic wounds. And that's important because chronic wounds are very difficult to heal by themselves. We've taken the enzyme found in maggot saliva responsible for breaking down necrotic tissue. We have cloned it and put it in a basic hydrogel for use at the patient's bedside to rapidly clean these wounds and help them to heal faster. We've had a phenomenal experience in the Catapult program. It has been wonderful to have such incredible support from mentors, from our peers across biotech and the broader healthcare sector. We have learned a lot in terms of how to present ourselves better. To prospective applicants to the EIT Health Catapult, I'd say absolutely go for it. We've learned a tremendous amount. We never anticipated we'd make it to the final. So if you're in any doubt, definitely recommend giving it a shot, and I think you'll be positively surprised.